DJ Gallery. I wanted to introduce our Art and Ed program. It's designed to further education and enhance awareness and raise money for charities. This program is epilepsy, and Conquer Your Own Rhythm is a 10-week art exhibit and 5 corresponding events. I'm also a registered health coach, so I would love to support artists in the show, their family. Just contact me directly through the gallery. Let's see. I wanted to introduce this event. The conversation is with my co-curator, Ted Meyer, and John Stern, the head of, the director of the clinical epilepsy program at UCLA, and 2 of our D&J artists, Riane and Michel, Romero. Thank you for coming, and enjoy yourselves. If you have any other questions, please get me after.
Oh, well, I was going to do introductions, but now I don't need to, but I'll add a little more depth. Okay, Dr. Stern, you are a professor and director of Epilepsy Clinic Program in the Department of Neurology at the Evans School of Medicine at UCLA. Also director of UCLA's Epilepsy Fellowship Training Program and medical director of UCLA's Seizure Disorder Center. You're focused on seizures, epilepsy, and clinical neurophysiology. Did I say it right? You have an active clinical practice, and you are also a photographer. So you fit in both sides here. You're an artist and a doctor. And I'm always sort of surprised, especially with the med students I've worked. A lot of them, especially the biologists, seem to be totally into being sort of twice gifted. Okay, Mara, Mexican-American artist whose work blends storytelling with experimentation, form, and texture, graduated from the School of Art Institute of Chicago, very impressive, in 2011. You're now showing down at Hive Gallery in Los Angeles, and you are continuing to refine your voice. Exhibit. And you, a teacher, born in Los Angeles, California, and your parents are both from Mexico, spent your early years living in Hawthorne, moved to Lenox, attended Cal State Northridge, where I taught for a little bit, a long time ago. You're teaching high school freshmen now for 4 years. That is, you're a brave woman.
Yeah.
The personal identity is part of your themes and intersectionality, and your work is influenced, all these big words. Your work influences include culmination of her family's different states of culture and how nocturnal epilepsy has affected your life. All right, got through that. I'm a little dyslexic, so I hate reading things. All right, so we're going to start for people that are watching out there. 1% of the population has epilepsy of one sort or another, so that's 3 million US adults, 456,000 children 17 and under have active epilepsy. The average healthcare spending on epilepsy and seizures was, in the United States in 2019 was $24.5 billion, which I had no idea on this. And just the cost for seizures, and you can explain the difference to us, $19 billion. So let's start with you as our expert, and you can explain some things. So when we first started the show, I really knew nothing about epilepsy other than the stereotypical people shake, they bite their tongues. In the movies, they always put a piece of leather, something in. You were telling me that is totally incorrect. So why don't you tell us a little bit about what some of the main causes, and that's another thing. I didn't realize it could be from so many different causes. epileptic seizures. So why don't you give us a little background, and then we'll go into sort of where you two fit into this.
I think a first important point to make is the distinction between a seizure and epilepsy. And a seizure is an episode. A seizure typically lasts a minute or two. It can be longer or shorter. And the seizure is the manifestation and a change to the person's awareness or control over their body due to an abnormal electrical rhythm in the brain. Most people who have a seizure don't have epilepsy, because seizures can be triggered by circumstances or medications or illnesses. Epilepsy is a condition where a person has seizures, plural, and these are not due to a circumstance, but due to something within the brain that's causing them. And so the typical estimate is about 9 or 10% of people will have a seizure during their lifetime, but about 3% of people have epilepsy at some point in their lifetime, which goes back to the point that most people who have a seizure don't have epilepsy. The number, about 3% will have epilepsy during their lifetime, is more than the number you gave a moment ago, about 1% of Americans, because for most people with epilepsy, it's not lifelong. And so that 3% is during a full lifetime, about 3% will have it, but at any given time, about 1% have it, because it can start at a certain point in one's life and then go away. And the fact it's so varied is because there's no one cause. And epilepsy is not a disease in the sense that it's one thing. I think it is really a very broad term for really, fundamentally, it's a situation in which a person has seizures that are not provoked by anything they did because of something that's amiss. And anything that causes that can cause epilepsy. And so it can be caused by a head injury. Traumatic brain injury is getting a lot of attention these days. It can be caused by an infection on the brain. It can be caused by a small malformation that might be there from birth but not really relevant until later in life. And by malformation, I mean within the brain. It can be caused by Alzheimer's disease. And so that's becoming a more commonly recognized cause for epilepsy, and that's in the older adult. Maybe a final point is that many people think of epilepsy as a condition of children. And that was historically true, that epilepsy typically developed in childhood years. But for the past 20 years or so, the age range where epilepsy is most likely to develop is in the older adult now. And it's not because children are having so much less of it, although with improved health, children may be having less in terms of some treatments, but because the older adults are living longer and having accumulation of risks to the brain. So going back to the idea that epilepsy is any condition where there's a brain change that creates a risk for seizures occurring intermittently. Does that answer your question?
It does. So we'll start with you. So tell us, did you have a seizure out of nowhere, or were things going on and then you had a seizure? Tell us a little bit how you first got diagnosed.
So a little bit of both. So I was 23 when I was first diagnosed, or had my first seizure rather. And you know, when you're young at that age, going out, having fun, all of that. Now I see the recipe is what I call it. So like, if you go out, you stay up too late, you wake up too early, you don't eat right, you don't get enough water, if you're prone, or you may have epilepsy or prone to those seizures, you're gonna have one. But that was my first time. And then I went through like a plethora of doctors who kept giving me different cocktails of medication, is what I'll refer to it as. And through that time, I kept having breakthrough seizures. And so these medications clearly weren't working. And so it probably took 5 years before I found an incredible neurologist who listened to me, who listened to what side effects I was experiencing on these different medications, and was finally able to find me a medication that, I guess lack for a better word, not stalled, but like kept my seizures at bay. And so I went, I think probably 3, if not 4 years without a seizure. And then out of nowhere, I had a seizure. And it was one of those things where I was like, dang, I thought we were past this. And so then, at that point, because when I first had it, I lived in Colorado, and at that point I was living in LA, and so I had to go through that whole process of finding a new neurologist and one that listened and wasn't the type that just kind of gave you some medication that they heard works. And so for me, that's been, I think, my biggest struggle is trying to find neurologists and doctors that are, I guess for lack of a better word, affordable, that really take the time. And so I found like when I had, I was making less money and on a lower insurance because it's all I could afford, the neurologists available to me were not listening and the ones just giving me cocktails and hoping for the best. And then once I started making more, I got better insurance, then I was able to get those neurologists and amazing doctors who took the time, who put in the effort and listened to me, and we did all the testing I didn't even know existed. And like now I'm in a place where I'm good. Like I've had like one breakthrough, but that was, again, I followed the recipe and that was my fault. Yeah.
How about you? How did things start with you?
I grew up as a child having instances where I would sleepwalk, so I've never known any peace in my sleep. Sleep talking, sleepwalking. Around when I was like 14 or 15 in high school, my friend talked to me during lunch about this thing called sleep paralysis, and then she described it to me and I said, oh, you know what, I think I've had that before. Next time I had it, I don't know what particularly happened because their whole memory loss thing, turns out it was not sleep paralysis, it was a seizure. We went through the whole discovery process and it's like, oh great, another thing in my sleep. Again, trying to figure out the medications, whether I can be stable with or without it. Because mine is nocturnal, it's like I can take care of myself mostly during the day, but as long as I take it before bed, I'm fine. Though recently, last year, I did have one on medication, so I had to start the process over again with Keppra extended release, 2 big pills, and then the struggle of dosages and the Keppra rage that it causes, which is something that you can't understand unless you have that change in your head, the chemical change.
So how do you figure out what drugs work on these guys? So, I mean, they each had to go through different doctors giving different dosages. I presume there's a number of different medications now. So how do you, as a doctor, figure out what's going to work on them?
We're fortunate to have many treatments today, and that's many medications and devices and other treatments as well. And identifying which can be the best treatment for each person is a journey, to put it politely, where the starting point is, what kind of seizure is it? What kind of epilepsy is it? Because sometimes that can lead to a narrowing of the treatment options. And then most people with epilepsy are seizure-free on medications, but by most I mean about 2/3, which leaves still a large number of people, 1/3, where the first medications don't work. And the choice of treatment becomes one of other options beyond those initial medications that are commonly used. And that can help a lot more people.
I want to narrow it down a little bit. So she comes in and she has her occasional seizures, she has nocturnal. Does that already set you in like, okay, maybe this drug will work on her and this one will work on her? Is it hit and miss?
Well, so the answer to your question is no, but there are other features that are important. And so the EEG, which is a test, the electroencephalogram is an important test. It's a recording of the brain waves, the electrical waves of the heart. It's kind of like the EKG of the heart, but of the brain. And findings in that can help identify what medication's more likely or less likely to work. An MRI scan, a picture of the brain, can be helpful as well. But in the end, it is hearing the description, understanding the person's needs. Some medications will have some side effects in one direction, other medications have different side effects, and trying to decide which medication is going to be easiest for the person to take, because you never want the treatment to be worse than the problem. And all this is put together in the way of keeping eyes on the whole picture.
So how long did it take to get something that worked for you?
I remember the only medication they've given me was Keppra. And once we got my family doctor in the initial diagnosis, once we had a certain number of seizures and then my parents recorded it, he went through the process and he just put me on Keppra and that seemed to work. Though there was the issue of the mood control and also just being hormonal as a teen. Though personally for me, they haven't found a trigger, so I live cluelessly. My scans come out normal, my MRI is great. I also recently had another EEG over the new year for 3 days. I'm still waiting on results from that, but none of mine have been documented on anything yet besides video. So the medication seems to work, except when it doesn't.
Sorry.
Yeah.
Let's jump in.
Yeah.
So, okay. You brought up Keppra, and I personally, I'm glad it works for you, but I have heard, part of me doesn't understand how it's still prescribed, only because I've heard nothing but horror stories from fellow epileptics, and when I was first put on Keppra, for lack of a better term, I felt crazy and out of control, and the mood swings and all of that. And I remember I was talking to this one woman, her daughter, who was 5. She was on Keppra, and she came down one day and said, "Mommy, I don't want to live anymore." And from every fellow epileptic who has been on Keppra, they all have a similar experience. I mean, as young as that, as old as what. And so for me, on my end, just because I've seen that so many times, it blows my mind that they, and no offense, but but that they keep prescribing it when there are so many other medications.
Anyway, do you want to talk to that about how certain things work for some people? And
Yeah. So I think that side effect that each of you described in different ways, which I think it's the same side effect, is the most common side effect from Keppra.
Yeah.
And I've seen many people who have some degree of what you've described, some more severe than others, but I've also seen many people where they feel like they're taking nothing, where they have no side effects at all. And it really speaks to how everyone's different.
Yeah.
But the real point is that if it is causing a problem, that's a reason to think again about whether it's the best medication for someone, because there's so many other options.
Yeah, and I agree totally. Because my seizures were so infrequent that for the longest time it was hard for me for anything to show up on the EEGs.
Right.
And so I had, actually at UCLA, I did the week-long strapped in a bed, electrodes on your head, and it wasn't until day 3 or 4 that something happened. But
Yeah.
and it's frustrating because you're I promise you, this is happening. But yeah.
Why does it take till day 3?
What was the question?
she didn't have a seizure.
Why did it take so long?
So the question is, why did it take so long for something to happen? And so ultimately, a person can have epilepsy and have a normal MRI, as both of you know and many people don't recognize. The MRI is not the definitive test for epilepsy. And many people with epilepsy will have a normal EEG. And so epilepsy is a condition that can be diagnosed very accurately without any diagnostic test being abnormal. And the diagnosis is based upon the person's description and maybe a witness, a family member, or a close friend's description as well, because the person having the seizure, of course, can't describe what's happening during it.
We have no idea.
And that becomes a reliable diagnosis. The testing I described would be what would be done in an office or during an evaluation. And if medications are not working, it becomes necessary often to go further into the evaluation and to pull medications off and allow for a seizure to occur, because that's a much more accurate test. It's a bigger deal because it's having a seizure. It's having what you're trying to avoid happen. But it becomes valuable information for making the diagnosis. And it's done in a controlled setting as safe as possible. And with that, better treatment can be possible, and that's the investment of that seizure.
Yeah, no, absolutely. Doing that, spending the week in the hospital, going through all of that, I feel like I was finally heard, I feel like I was finally seen, and like again, lack of a better term, I feel like we found the perfect cocktail. and yeah, so
I might add something to the question, because part of the question is, why did it take several days? And a person with epilepsy, well, people with epilepsy have seizures across a broad range of frequencies. Some people might have a seizure a year, another might have 3 a day. But most people are not having several per day. And one of the most frustrating parts of epilepsy is not knowing when the seizure is going to occur if they're not controlled. I mean, once they're controlled, medication's working, some confidence can be built up that things are squared away. But if they're not, it becomes every day is a reset of, is it going to happen today? And the reality is that even without medications in those situations, it wouldn't happen every day. And people will take medication every day because they don't know which day it's going to happen. And so it may take several days off medication for first medication blood levels to come down, but also for the day that it was going to happen for it to come around. And that's a part of epilepsy that's only being better understood in the past 5 or 8 years, as far as the natural cycles of the risk, which we really couldn't measure before.
So I'm going to ask just because I'm curious, and I'm not asking this because of what you were saying. So my wife's kid, 20, I think he's 24 now. There's a lot of recreational drugs. And is that a danger with this kind of stuff? Molly and things like that? Or, I mean, it's pretty prevalent.
Depends on the recreational drug. And some are much more risky than others.
Yeah.
And many today we just don't know, because the number of options has increased as people have created new recreational drugs.
Right.
But it's not as if all of them are equal risk, and really hard to say.
I think a caveat to that too is I don't think any epileptic is going to go into the doctor and be like, hey, so I really want to try Molly. Is it okay with this drug or whatever? Can we test it? Like,
I've had that question.
Are you serious?
Yes.
I would never.
That's so funny. And I was thinking more of like a first seizure. Like,
Yeah.
could it
So
be the
that goes
first
into the 10% I said of people who had a seizure. It can be a recreational drug. Cocaine is one that can cause a seizure during intoxication. And one of the most common causes of seizures that are provoked would be alcohol. But it's not during the intoxication, it's during the hangover, the withdrawal.
Oh, interesting.
Yeah.
Oh, yeah.
Question over here.
Does it harm the patient to take it every day, even though you don't need it every day?
Questions about whether the medications harm the person.
Not harm, or just, is it not good?
So I think there are two answers to the question of what are the problems of taking medication every day.
Right,
And one,
anti-seizure.
right, anti-seizure medication. One is there a side effect the person's aware of, creating a burden of just getting through the day because of, you described emotional side effects, but other medications can have other side effects, which can be also really undesired.
Yeah.
But that's something a person's aware of. The other question is long-term side effects, on the heart, the bones, the liver, which also, it really depends on the medication. And so some medications are safer than others, but then having seizures is a danger. And so with any treatment for any condition in all of medicine, it's really that balance is whether the condition is scary enough, but what I mean by that is dangerous enough to warrant a medication that carries some risk, because the overall benefit is there. And that's, again, a decision that's really has to be made on the level of the situation.
All right, we're going to switch gears here a little bit. So we are in a gallery that dedicates itself to showing artwork by patients. And one of the things I always talk about is that those of us, I have long-term illness, you guys have this, we do artwork about it. And people from the outside might go, oh, they're just being self-centered, they're doing artwork about their, whereas if somebody went somewhere and saw a beautiful landscape and they painted it, nobody would go, oh, they're being self-centered, they're drawing the landscape they saw. So I always like to talk about how much energy it takes to be sick. And it's always on your mind. So it makes sense that you would do artwork about the fact that you have some sort of condition, whether it's major or minor. So you guys are both in the show because you've done work about your condition. So why don't you talk about illness as views in each of your works, and then you can talk about your photos after. Whoever wants to start.
Go first. So in my artwork, something that I heard when I was studying art as a high schooler and in my undergrad at Cal State Northridge is that sometimes what makes great subject matter is what you know. And, and checked off my list of what do I know? It's like something that wasn't in the forefront, but in the back of my head is, oh, my condition. So at some point I had to touch on that and just speaking out and giving awareness to the misconceptions about the condition as I also learned about it myself. And the nature of the condition where the memory loss and things that other people may not experience unless if they are a part of the community.
Yes. I think for me, like my art in general is focused within and what I feel and what I experience. And, there's moments where it's hard for me to talk about my epilepsy, and then there's moments where I feel very comfortable and open talking about it. And it's hard, so like I make sculpture based on how I feel. And so with my piece, it was like, how do I make it feel where it's tight, where it's movement and constricting, but also like, I call it seizure territory, but like, when you get like floaty and like spacey and weird. So like it, like also creating that. And I think, and I told Pam this, when I first walked in here, once the gallery was, day of the show, I like immediately started crying. And it was a feeling of being seen and so many things that I don't even know how to put into words or put into art, and somebody else did it. And so I think for me, it's like people may not relate all the time to your work, but if one person does, then you let that one person be seen.
You said sort of the floaty and spacey feeling, and Michel, right? Your artwork's in the other room that's a little similar to the thing behind you. It's about being constrained and restrained a little bit. And I'm just wondering, like, for those of us who don't have a seizure, can you describe it more? And because I think that's what's so beautiful about the artworks, that you're describing these feelings that the rest of us may not have experienced.
Right, so I think the one that you're talking about, the restraint, is me on my bed and the hands are gripping. That's once the seizure is beginning. Well, the other piece talks about that, the piece with the hand. When I feel the tingliness in my hand and it begins and it's traveling up, and I try to massage it out, that's when I know the seizure is going to take over me and paralyze me in a sense. So that's step one to the seizure, and trying to call out for help if I can. And then the feeling of your muscles contracting and feeling like you're going to break is on there. So.
But how does that, like, if you were describing something that sounds to my ears completely opposite, sort of floating and free?
Yeah, floating and free makes it sound way prettier and fun than it is. but I do know I use those words. For me, it's like instability, like kind of dizzy, but kind of not, and like you can't grasp anything, and your brain just like nothing connects. Words don't connect, and all of that. And I don't know, like the room is not spinning, but like.
Yeah. It sounds
But it's about being aura, and so you're saying that both of your auras are different, which then makes sense that people with epilepsy have
Oh, yeah.
a range of.
So maybe I can jump in here
Yeah,
because
before you do, it sounds to me as a layperson, like there's the physical manifestation, which is your muscles contract, you can't move, and then, but really what way you're interpreting it is through your brain. It's what the brain is sensing, which may be different than what the
body
looks like.
Yeah.
At least that's what it sounds like to me, but anyway,
Yeah.
explain.
So how the seizure manifests depends on where in the brain the seizure arises. And the brain is not all the same through the entire brain, as most people know. There are different areas of the brain that do different things. And so people with epilepsy will have a broad range of different experiences during their seizures based upon how the seizure develops, where it develops, and how it spreads. But beyond that, and it's bringing to mind, there's a symposium I spoke at a few years ago arranged by the LA County Museum of Art about creativity in the brain and communication of this. And what I spoke about, which I'm going to try to summarize right now, is we assume that there's a reality to the world around us, but obviously we all recognize that that reality that we're perceiving is manufactured by our brain. And that reality comes from a commonality. We all experience similar realities because we're all in the same state. But if the brain develops an abnormality in the perception of the world, the brain is then creating a state that doesn't exist in the reality that many people share. And you'd struggle to explain your experience.
Yeah.
And how I understand that, because I've spoken to many people who have similar difficulty, is that you're trying to explain to other people a state that maybe you are the only person who ever experienced. And there are no words for something that one person has experienced, because words that we use are social. They're meant to be what everyone shares.
Yeah.
And so the experience of beginning of a seizure can be very distinct and unique to the person. It can be similar to another person's seizures, and if so, that's informative toward what's happening in the brain during it. But that unique experience, besides being maybe a barrier to sharing, which we all want to share our experiences, and that can be difficult, the uniqueness of the experience also spills over to this recognition about epilepsy in the arts. There's been a long sense of, well, do people with epilepsy have more creativity? Are they more in the arts than in other medical conditions? And I'm not sure if that's true or not, but that exists in some concept. And there have been articles about famous individuals who were creative individuals across the arts who had epilepsy. But there are other people who don't have epilepsy who are in the arts, obviously. Yeah. But one explanation for maybe that being present is a need to express oneself for something that is so powerful and meaningful. And the arts are a way to express in a non-traditional narrative of this plus this plus this.
Right.
And it becomes expressive.
Right.
And that's part of what, the value of the arts for the artist, I believe.
For sure.
I will fight anyone who argues with me about people with illness doing better art than the general public. I know there's creativity everywhere, but there's something about this work that Pam is showing here that it has a strong narrative, it's personal, it's got a story to tell that I just think is really important. Let's talk about your photos that are up on the wall. How do they fit in here?
So I think it's for any person who spends a lot of time, a lot of emotional energy, a lot of cognitive energy doing one thing, it's good to have something else. It's good to have some way of reframing oneself and focusing on something that is more emotionally complementary. And for me, that became photography. And I was in a camera shop a few years ago and looking at a lens, and the guy behind the counter was probably a photographer trying to make small talk with me and said, well, you know, what are you into photography for? And my answer, which was glib, was just, well, for my peace of mind. And it's about having a way of moving toward a different perspective. And I was thinking about why photography, and communicating with Pam, and I think it's maybe analogous to how I see neurology, that in both photography, there's a technical element that has to be known, and there has to be some rules that need to be followed for it to work out, but there has to be very much a broad picture of the whole. Otherwise, it doesn't have the same power. And I think, at least my experience of clinical practice neurology, it's the same in that there has to be a great technical knowledge, there has to be some understanding of certain facts, but it doesn't work if you don't have a full view of the whole. Because the whole is what matters, not the minutia.
All right. We're sort of rounding toward the end here, so why don't you guys tell us a little bit about when your friends who see you who don't, you know, they might know you have epilepsy or have seizures, but they haven't seen you go through it, but they see your artwork. So why don't you talk a little bit about how you explain it to them, and we'll sort of end there. I mean, do they ever say to you, why don't you draw plants instead, or, you know?
I guess I'm fortunate enough to be surrounded by people who wouldn't, who are supportive and wouldn't think twice that I would make anything about, like, wouldn't look down upon it, I guess, or be...
But do they understand it? Can they look at your artwork and do they see it as part of your story and part of your life experience? Like your piece with all the lights that's blinking back there, to me that really, I mean, when I saw that, I thought, oh, this is the neurons firing and things are going off and they're sort of random, and like, to me that was a really nice visual metaphor for what's going on, and yours being held down and you're not totally in control. They're both really strong pieces.
Thank you.
And like, so do you ever feel you have to explain that to people, or do they even ask, or are they just like, oh, she's doing that epilepsy art again?
I don't think I've received a question like that. I think, yeah, I don't know.
Personally, I was artsy growing up, and then I received my diagnosis. I was an artist first, a person first, then I gained the epilepsy part of my identity. So as far as introductions and telling about my work and how that might come into it, they wouldn't have anything negative to say about it, more supportive of that it is part of my life, my challenge, but also that you know, just navigating introductions, even, for example, like my dating life. Can you do CPR on somebody, right? And that I shouldn't sleep alone. And as a fun fact, I am dating a doctor, you know, and he enjoys the quirks, and it's like, yeah, and my friends are also aware for sleepovers, you know, Las Vegas, other things. Like, yeah, fun fact, remember guys, seizure disorder in my sleep. Here's my medication, giving me a little briefing on first aid. But yeah, they'd love to see the art, and as far as my introductions go, it is part of my, you know, icebreakers, because it's something relevant, and I'm open to chatting with my students or other people.
That's great. Anything else from our...
Well, I also just wanted to say, well, don't go ahead. That one of the big reasons that I do all these shows is to
Here,
create a community.
why don't you come up and grab a microphone? I'm just going to tell you, when I was in college, my first girlfriend would have night terrors, which I had never experienced before. And I remember, like, the first time I went and spent the night in the girls' dorm, that was when everything was not co-ed. And at about 3 a.m, this unbelievable scream, and I'm like, oh my God, not only I don't know what's going on, but I'm gonna get thrown out of college for being in the dark.
Yeah.
Well, one of the reasons why I do these shows, and it's really important to me, is to create community. And it's important for the space It's important for the space for everybody, the artists, and you have more common than you think. And it's more important to know that someone's there, and so that you're not alone in this, that you're not alone in these diseases, these illnesses. That everybody has something. Everybody, whether it's epilepsy or multiple sclerosis or whatever, everybody has something. So, yeah, I just wanted to put that out there.
It's true, and one thing doing these different shows on different illnesses, so many of the same things pop up. The symptoms are different, but mentally, a lot of the same stuff happens, Well, I want to thank you all. I also, again, I want to thank Pam for having a gallery that's willing to show.
Thank you. Thank you.
It's